Good morning, everyone. Thanks so much for joining Indiana SHIP, the State Health Insurance Assistance Program's Facebook Live program this morning. I am joined by my co-hostess, Melanie Garland with SHIP, and we are joined by Kim Bremer, who's the Director of Pathways for Aging in Indiana. And also, along with Kim, we have Ashton Driscoll, Jocelyn Coffey, and Taylor Walters. We really appreciate you ladies making time to help educate our viewing public about the Pathways for Aging program. I know I see a lot of commercials about it, and it's nice to be able to have some information directly from the source. I know it's a super busy time for all of you, and Melanie and I really appreciate you joining us. So good morning.
Hi, good morning. Thank you for having us. We're very appreciative to take this time. We're excited to get out the news and get out the details to Pathways for Aging. And I know there's lots of questions surrounding it, so hopefully we'll be able to answer some of your questions today. But if not, we have multiple resources listed at the end of this presentation for you to be able to reach out and get your specific questions answered if we have not accomplished that during today's presentation.
Right. Thanks a lot, Kim. That we will have this posted on our YouTube channel and recorded on our Facebook page as well. So folks, if you'd like to pose a question, just chat that in, and Melanie is going to be monitoring that. And then Kim and the other ladies will take the questions at the end. So tell us what you know about Pathways for Aging, Kim.
Well, let's go to our slideshow. We hopefully will be able to accomplish everything during that. So first of all, today we'll just walk through about what the CMS waiver approval process occurred, why we even started this long-term service and support reform overview, specifics about what Pathways for Aging is, talk about who is the enrollment and how plan enrollment occurs. We'll also talk a little bit about dual eligible, those people who are qualified for Medicare and Medicaid services, and then talk about the advantages of Pathways when it comes to the care and service coordination, and then the support we're doing for all of our members with our member support services, and then conclude with some outreach and some service resources for Pathways. Next slide. So just want to announce CMS has approved what we consider our waiver amendments to create the Indiana Pathways for Aging program. And they also approved the other waiver that we submitted for home and community-based waiver, which is called community integration and habitual labor waiver, our waiver family service support waiver, our TBI waiver, and then what majority of our other things outside the pathways would be considered is our health and wellness waiver. So that was a huge accomplishment, so we're pretty excited about that. Next slide. So why did we even start this? Our goals in creating this long-term service and support reform was to offer faster eligibility for our members. We are moving in this process to try to create this managed long-term care and service, which is called MLTSS. And that's the same thing as called Indiana Pathways for Aging here in Indiana. It's also to help change how Indiana services our members. Instead of doing it just by transaction, we are trying to pay and get our providers paid through and increase outcomes. So that means we're giving better quality to our members. We also want to integrate the LTSS data services so that we're creating unified data points to help offer the best care necessary. Another component of this is we see that there is a direct service worker issue in the state of Indiana. And so by creating and trying to create this MLTSS program, we're also supporting the growth and retention and training for people who would be providing care for individual in our population. Also, we want to create a stronger roadmap to home health. so that we're not just looking at a roadmap to facility care. We really want to integrate and coordinate with the home health services so that people can age in their home if that is what their choice is. And lastly, we want to integrate HCBS waiver services. And what that means is people who are currently on age and disabled waiver, if they're in the population for pathways, will be incorporated in with our Medicaid fee-for-service, and it also coordinates directly with the Medicare services. Next slide. So Indiana Pathways for Aging overview. Next slide. So what is this? This is an MLTSS program which delivers a system to manage. We have managed care entities that will coordinate Medicare, medical, and long-term care services for those people who enroll in Medicaid beneficiaries. Pathways is aimed for members who are Medicaid eligible, Hoosiers 60 plus, and that we called our program Indiana Pathways for Aging. We currently are underway in enrollment, so people are there and they still have the ability to change their plans. Indiana Pathways for Aging goes live July 1st, so we're 14 days out from this point. The difference in this program also is the MCEs, which are the managed care entities, and we'll talk about who those providers are, will be not only coordinating, helping with traditional care where, delivering acute and preventative care, but they will also be the one managing and coordinating home and community-based services as well as nursing facility services. Next slide. So what is Indiana Pathways? Indiana Pathways for Aging is a managed Medicaid program launching July 1st, and there are 3 principal focus points that we have. We're looking to create a person-centered service and support program. We're trying to ensure smooth transitions between not only payer, whether it's Medicaid to Medicaid waiver to Medicare, but also smooth transitions from different care settings. So if you're coming out of the hospital, a smooth transition to whether it's a rehab center, a nursing home center, or a home health center. Also, our other large initiative is access to service. Our goal in creating this program is to increase access to services and
Apologies, Kim's computer just died, so we are getting that set back up.
Okay, please be patient while they're getting back and rebooted here. While we're waiting, I just thought I would let everyone know we are monitoring your comments, and we do thank you for your questions, and we will be working with the Pathways for Aging team to answer as many as we can at the end of this session. But I know that they will also be sharing access to information that you can call or email or websites that you can access to get some of your questions answered as well. Okay.
I apologize for that. I seem to be jinxed on the technology. Just kind of does this to me every so often. So can we go back to the slide before? So I will just pick up where I was. We just discussed the pathways for aging, why we did this. We also want to make sure you understand who what we consider, we call MCEs or managed care entities are. The 3 MCEs that have qualified in the state of Indiana are Anthem, Humana, and United Health. All 3 of these MCEs have to qualify to be our health plans, also have to have a what we call a D-SNP program. A D-SNP program means that there is a specialized Medicare program that would align with the Pathways program, and that is how these were picked. Next slide. So who is eligible for Pathways? We want to make sure it's very clear who fits in this. It is people who are 60 and above, who are Medicaid enrollees. They could be people that are Medicaid based on age, blindness, or disability. People who are in our pathways could also be eligible for full Medicare benefits. Those people we consider and we call dual eligible. We could have people that are in pathways that are currently in Medicaid recipients in a nursing facility. They would be incorporated in the Pathways program, as well as people who are currently receiving A&D waiver, and those people getting that home and community-based services. People who are not eligible for Pathways are people who are under 59 or under, people who are partial Medicare beneficiaries, meaning that they do not meet the Medicaid eligibility to be in Pathways. Those people who are DDRS waiver recipients, which includes TBI, people who are IDD residents in ICF, people who are currently PACE recipients would not be incorporated in Pathways. Also people who are in state operating facilities. And then there's several other components that are also included in here who would not be eligible for Pathways. Next slide. So we want to make sure it's very clear what Pathways covers. So all members in Pathways get the hospital services, lab services, surgery services, preventative care, primary care services, physician services, some benefit, behavioral health and addiction treatment services, DME, home health, hospice, dental care, as well as vision, hearing aids, and EMT, and that's non-emergency medical transport. People who are in Pathways who are dual eligible will still be able to get their Medicare services under Part A, Part B, Part D, Part C. Those would not go away. It just enhances it, and the product with Pathways will coordinate services between the two instead of making it siloed, and helping make sure that our members get the best care and all services they need. Next slide. So let's talk a little bit about enrollment and plan changes so that you have a clear step what the members have gone through to become enrolled. Next slide. So in May of this year, all of our members would have received a 60-day notice for them that their plan, benefits, and contact information. We sent out letters starting as early as February to all our members, asking them to reach out to our enrollment brokers to choose a plan. If they had not chosen a plan, we did an auto enrollment in May. And so in May, all of our members started receiving notices of who their benefit plans are and contact information. Starting in June, they also received welcome packets and member handbooks from the specific health plans that they have chosen. And then they also started receiving those people who are HCBS or what we call complex members would have also started receiving member calls from the health plan. As we said, Pathways for Aging goes into effect July 1st. So what will change is if they were currently in Hoosier Care Connect, or what we consider fee-for-service Medicaid, they will be transitioning into the Pathways program. Next slide. So we wanted to make sure we stress that we have created the Pathways program around choice. Our goal for members is to make sure that they had as much opportunity to choose their health plan and to change to choose their health plan as possible in this process. The letters that went out in February and early March, as we said, indicate that they can call an enrollment broker, ask about the different plans, and to get information, plan comparison, as well as choosing their plans. That number is 87 Pathways 4. We strongly encourage members to contact the enrollment broker. They're well versed in helping them triage through the enrollment process. Individuals that did not choose their plan by April 30th of this year were auto-assigned. That auto-assigned program was put into criteria. We tried to align as much as possible with any product that they have already used. So if they had been in a Medicare Advantage plan with one of the 3 MCE companies, we would have aligned with that first. And then it went down through a whole criteria to random. Members still at this point have 90 days after July 1st from the go live point to change their plan. So our goal is for members to have any opportunity to change their plan to get it into the plan that they would like. Next slide. So as I stress this, these are different opportunities members have to be able to change their plans. Members can change their plans, as I said, 90 days after go live, which would be July 1st. They also will be able to change their plan at least once every calendar year. They also can change their plan during the Medicare annual enrollment period, which is that October to December period. You can change your Pathways plan as well. Also, anytime that a member has a Medicare and a Pathways Medicaid plan that are not aligned, which means that they're not under the same corporate umbrella, they could also change their plan. And lastly, we really give an opportunity for any just cause. So if a member has a just cause that feels like that they would like to switch from a plan, they can also do that at any point. Members can call that MCE, the enrollment broker, to change at that 87 Pathways 4. That hotline is open Monday through Friday, 8 to 7. So let's talk about a little bit about dual eligible and one of the components that help us with this. Over 80% of the individuals who are enrolled in Pathways are considered dual eligible. That means that they are Medicaid and Medicare eligible. And our goal with this Pathways program is to integrate those populations so that there is much more stronger care coordination between the Medicare services and the Medicaid services. Currently in Indiana, we have these programs called D-SNP, which is specially segmented Medicare programs that are set up for people in this population. And we have over 49% of our Medicaid Pathways people already enrolled in a D-SNP that would align these services. Next slide. So how does that work when we talk about that? Dual eligible individuals are eligible for both Medicaid and Medicare services. The Pathways enrollment brokers only handle the Pathways Medicaid MCE enrollment, and then Medicare services are advised by individual brokers, as well as SHIP counselors can help give you information on some of those Advantage plans. There are Medicare Advantage plans tailored to the duals. They're called dual eligible special needs plans. Dual eligible special needs plans, or D-SNPs, have a contract with the state Medicaid authorization to order and to operate. So they're specifically set up for us in this population. Pathways MCEs are required to offer this aligned D-SNP plan through the same parent company, and that provides to enhance our coordination and integration of experiences in care. FSSA goal is to ensure dual eligible individuals have access to the highest possible level of coordination and alignment between Medicare and Medicaid benefits. That way that our members can get as much services as possible in the easiest mechanism. All dual eligible individuals retain the opportunity for freedom of choice. We want to definitely encourage that. You can enroll in a Medicare plan. You can keep with your fee for service. You can be in a traditional Medicare Advantage plan with one of the companies that are not aligned, but you also can align with a D-SNP program. So what this is when we talk about aligning is aligning a plan with a pathways is to enroll in a MCE that we have operating that is also operating a D-SNP, that dual eligible special needs plan to provide the Medicare benefits. It is available for individuals who are both Medicaid and Medicare eligible, and Pathways members who have decided to join a D-SNP run by Anthem or Humana or UHC for the Medicare benefits will automatically be enrolled in the same Pathways MCE program. Next slide. So we kind of just show you this, that we want to make sure that it is kind of complicated. People who are on original Medicare or Medicaid Advantage plan have a choice to keep that plan, or they can choose to align to a D-SNP plan at the time of enrollment with Pathways. We want to make sure you're aware of that all members can keep their, either whether it's a Medicare original Medicare, which is fee for service, or Advantage plan, or a C-SNP or I-SNP. They can keep that plan as well as then enroll into a Pathways plan. And then there is a whole dual eligible area that you can list on our Pathways plan to get more information on that. Next slide. So why is this? We want to kind of talk about the advantages of Pathways. Care and service coordination is probably our biggest advantage and why we're encouraging individuals to get into those aligned plans, but also to the advantages of us rolling out Pathways in general. Our members will get a lot more points of support. And these are some of the points of support we want to focus on. So we also have enrollment brokers, so they will be able to have an enrollment broker to talk to and help those members choose their plan, change their plan, or triage through that whole enrollment process. In addition to that, all members will be given a care coordinator. That is somebody who will support them in their health care needs. The care coordinator can assist in multiple ways, but triaging through their care needs is essential in this, and that will also coordinate with the Medicare or Medicaid services. That care coordinator works with all providers that would be servicing the member to ensure the best care. In addition to that, for people who would be getting what we consider currently A&D waiver services or needs for home and community-based services, you would get an additional service coordinator. Those people are looking at individuals to get that supportive care necessary for them to flourish and succeed in their healthcare needs. In addition to that, we are required that the MCEs have personnel and assist with navigating between the Medicaid and Medicare benefits. So the members will be able to understand what actually they have access to, what Medicare benefits would, and then what Medicaid benefits could accent and assist with, helping where there is extra needs. In addition to this, we also have created a member support service vendor who's set up to support all of our members triaging and through issues with that. In addition to this, all three MCEs, so depending on if you pick Anthem, Humana, or United, also have their own member support services lines that help with the members. So you get extra support two ways, both with the state member support vendor as well as directly through the MCE member support. Next slide. So what is the care coordination structure? We want to kind of stress this because this is really a key component on the success of members' health, but also the reason why we're laying out this managed care structure. It is offering all members patient-centered care coordination. What it means is that they're reflecting the needs to assist with the planning, asset, and management of the healthcare and the healthcare related needs. MCEs are required to have 2 levels of care coordination. So you are either in the main case care management that's available to all members, or as I talked about, if you're a complex case management where there are high risk or more complex needs, you would have an additional care coordinator involved in that process, but then have somebody who's more specialized in those higher needs. Members receiving LTSS services in nursing facilities or home and community-based services will have that, must have a service coordinator in addition to that care coordination. Members receiving home and community-based services would be considered complex case management. So we just want to make sure you understand we automatically bubble them up into getting those extra support needs. Next slide. So service coordinator. I know this is a very complex concept. I know we talk about it here often. Care coordination is talking about the care, but the service coordination is that additional service. It proceeds and does more assessments, more discovery, more planning, facilitation, advocates. They're collaborating and monitoring more that holistic or environmental and social needs of each individual. Service coordination is responsible for developing and implementing the service plans. The service plans look, as I said, as that patient-centered whole care. In addition to the care coordinator services, all members who have determined nursing level of care, we call NET FLAC, and receive home and community-based or institutional care will receive that care coordinator, that service coordinator to help with and making sure that any environmental and social service needs are focused on. Service coordinations specialize and focuses on supporting long-term services and support, medical and social, housing, education, and other services that we can get, that will be provided through this funding. All members receiving service coordination will also be assigned the service coordinator who works with the member's care coordinator to make sure this holistic services are delivered. Thanks. So we want to make sure you understand that the MCEs are provided in this transition a lot of information on our members. So we're hoping that by giving more historical information and data that we can make sure that we are not starting from ground zero and that we give a leg up and make sure that this transition and continuity of care process is smooth. All members' data for the last 6 months of claims have been sent to the MCEs, not including diagnosis, hospitalization, emergency care visits. They also are looking at existing service plan. They will get existing assessments, level of care assessments, as well as receiving the authorizations for current services provided. The MCEs are well versed on that historical background for all of our members through this transition to ensure that there is no interruption of care and services. Next slide. So the members and the providers also are engaged in this transition process. The members will be receiving that handbook and welcome packet from the MCE. They also, if they're in that complex area, will also be receiving introduction calls prior to go live, but other members who are not will be getting calls and outreach after go live. All members' service plans will be renewed or reviewed. They'll be looking for upcoming appointments, medication, and any needs and priorities so that the member does not have any interruption of services and can get all of the necessary appointments and medications necessary. At the same time, providers have been outreached from the MCEs. We've been doing a significant outreach, but also for those providers, they'll be doing the transition. They'll be reaching out for authorizations. They'll be transitioning authorizations from our current system into the MCE system, and they'll be getting outreach from them July 1st afterwards. In addition to this, for those people who are on complex, the care coordinators from the MCE will be reaching out to those providers directly to ensure that there is no interruption of services. And then there will be ongoing provider engagement and communication and education. And if any of the providers want some more support, we encourage them to go to the MCE websites and their provider portals, because there is ongoing webinars and other resources available there. Next slide. So let's talk about what the member support services are. This is something that is new to this program, and we've done this and added this to give another layer of support for our members through this transition. That member support hotline will be available starting July 1st. It is there for members to advocate, to help them through this and give them access. We really are aiming for this member support to be a direct assistance with the pathways coverage, helping resolve any issues or that members may have experienced in this transition. It includes educating them on the MCEs, how to access services. It's also assist members with just general issues accessing care, and ensures members' voice can be upheld in this patient-centered planning and care service coordination. It also supports and navigates in our issues of the MCE and providers, and then it will educate any member on grievance and appeal process and assist with that. Starting July 1st, members are able to reach out to the MSS vendor by calling 877-738-3511 or emailing indianapathwaysmss@maximus.com. Those phone calls, our hotline is available Monday through Friday, 8 to 8. So we do encourage all members to use that service for extra assistance. Next slide. So what is Pathways and Outreach? It is very important to us, next slide, that members and providers and any stakeholders in Pathways have access to resources and information. We strongly encourage anyone who is wanting more information to go to the Indiana Pathways website at www.in.gov/pathways. And so once you get to that website, as you can see, we have segmented pages set up for everything from members and caregivers to agency and advocates to providers, as well as general resources. We have the plan selection notices. We have promotional toolkits with brochures available in there. We also have the plan comparison and general FAQs. We strongly encourage people who are having very specific questions to definitely visit our FAQs. We are updating them regularly, and it tends to answer majority of the questions that have come in, so that we can make sure that we can give you as much resources as possible. You can also go to that website and you'll see our past webinars that we have hosted. They're available to that, and different educational videos that give more information about the Pathways program. And I want to thank you very much for your time, and I guess we could open it up for questions if we'd like to answer some questions at this time.
Okay, so we did have quite a few responses and lots of viewers. So we just want to thank everyone for tuning in. And just a quick reminder, This video will be saved to our Facebook page under our video section, and then also it will go to our YouTube channel as well. So those resource informations and numbers and links that Kim shared with you will be available too. But we're going to do our best to answer some questions. And Kim, just be patient with me. Some of these I know that you answered throughout your presentation, but we'll just want to make sure that we're covering what folks did ask, just so that everyone does understand, because it's a big deal. And a lot of people are nervous about the change, just like anyone would be with the change. And when it comes to your healthcare and your access to services, we totally understand. So
Yeah, and I saw some comments in there. I do want to really stress, and I think there was some misinformation that was received by the enrollment broker. Pathways for Aging is a Medicaid program. Your Medicare program is still separate. It does not mean that you do not still go to your agents and talk about your Medicare program. You can still be in fee for service. These are two separate programs. You'll have two separate cards. But our goal is to have them align and work together with the information. It does not mean that one replaces the other.
yes. So along those lines, Kim, can you clarify, as folks are getting their Pathways cards and will they still use their Medicaid card? Is their member number going to change? Can you talk a little bit more about that?
Yeah, so the Medicaid card will be replaced with their Pathways card, but the Medicaid member number will be the number that will be rolled into the Pathways MCE card. So your Medicare number should not change. It just rolls into it. What will change is you will no longer have A&D waiver separate than Medicaid. Those two will go together underneath these MCE cards. So if you need services that you traditionally had gotten through the A&D waiver, those would have to be run through the MCE. So those be combined. But that does not mean that card will replace your Medicare card or your Medicare Advantage card if you have Medicare Advantage.
Okay, thank you for that clarification. And I think it's just kind of best, if you are on Medicare, continue to, and you have the Advantage plan, continue to carry that card, continue to give that to your healthcare providers, as well as your Pathways card. That would be your secondary payer source there. So Kim, another question, or kind of themes of questions that we're seeing, is more about networks and coverage. So can you answer if there's going to be a change with, if I was on traditional Medicaid, and now I'm moving over to Pathways, do I need to check with my doctor? Is my NCE going to give me that network information, or how is that going to affect my health coverage?
Sure. In this transition, we do want to make sure we stress that all three MCs are required to have an open network for the first 2 years, which means that any willing provider who wants to provide services or bill the MCE is required to allow for that. So that means even if your doctor hasn't enrolled in the Pathways program through Anthem or United, they can still bill and provide services for you for that first 2 years. So we want to make sure you understand that members don't feel like they have to switch immediately services. You just have to contact your provider directly if they're willing to bill that services. Medicaid will be paying, whether in or out network, the same amount for all providers in that transition period. So for the first 2 years, it is the Medicaid rates. All MCs will provide for all of their providers who are doing that. But in saying that, they are actively enrolling and contracting with the 3 MCs, and currently are uploading almost daily, weekly, new provider network listings. So you can go directly to the MCEs and look, and they will have provider listings for those people who have already contracted. I just say that because we're still actively involved in that contracting process, and I don't want to scare any member away from one MC or another because they're worried about that at day one. I would kind of encourage them to look at the product, look at the different MC that they feel more comfortable with, go ahead and take that step into that MCE, and then try to figure out where their providers, or reach to their providers directly to determine which provider is willing to be service the different MCE.
Okay, thank you for addressing that. So, along with that transition theme, folks that are already on the A&D waiver, and we're kind of changing what we're calling it and how it's going to be delivered. So we're getting some questions about, is Pathways replacing? We've had a few different area agencies on aging mentioned in the comments here. So the area agencies on aging, kind of depending on where you live, they might have different names. We've had Lifestream mentioned. I know in my area it's Workin More, in Susan's area it's Socoa. But how is that? Can folks still contact those places about enrollment into Pathways like they've been used to, or how is that changing as far as if I'm new and want to see how I'm eligible?
Yeah, so currently the AAAs will, which are the general term for all of them, will still be the mechanism in the state of Indiana due level of care to qualify for waiver services, no matter if they're at which MC they're in there. So if they are not currently a Medicaid provider or Medicare enrollee, they would still contact their AAA and help to get that process, talking about enrollment and that component. If they are currently enrolled in Medicaid, we ask them to reach out to the Medicaid enrollment broker to determine which MCE. And the MCEs also offer lots of support. When it comes to case management, the service coordination component, we would consider our current AAA service care coordinator or care managers. Each MCE is the one in charge of subcontracting or having their own standalone service coordinators throughout the state, so to ensure all members have a service coordinator. So it really will depend on where you are in the state and who you've assigned or who you reached out and who's available for that service coordinator component. Some of the MCEs are working directly with a lot more of the AAAs to continue that service with our current service coordinator. Some are taking it more in-house depending on what area they're in and what their AAA in that area is willing to do. I still strongly encourage, if they are looking for services like the traditional A&D waiver, to go ahead and start with the AAA phone call, because that gives them the first entrance into it. But if they have already been assigned and they have a Pathways card, they should also talk member services. Their member services through the MCE would be quicker for them to get care and services available if they go through the MCE.
So if they are receiving the home and community-based services, through Pathways and through their specific MCE, is there still a standard of care that will provide like in-home visits through the service coordination?
Correct. It's the same care service level. It's just being monitored and supervised by the MC. They're required to do same face-to-face once a quarter. They're still required to do all assessments. They're also supposed to, response time is supposed to be actually a little tighter under the program of MCs if there's any issues, and they are required to do monthly care coordination meetings. So they call it interdisciplinary care team meetings. They are required to do that on a monthly basis. So if anything, we're hopeful that it will be much, much more hands-on and much more coordination of care and access to the members.
Okay, great. Yes, thank you for that clarification. I know a lot of the questions that are popping up on this live are a lot of the questions that Susan and I and a lot of our coworkers and a lot of clients that have called us have asked. So we really appreciate that Now, some of the questions that have popped up, Kim did a great job answering during the presentation. So I just want to kind of overview the eligibility is if you are on full Medicaid and you're over the age of 60. That's what Pathways for Aging program is for. And then we had someone ask, like, why did I get enrolled? Well, if you were on full Medicaid and over the age of 60, that would be the reason that you did get enrolled. And again, I do urge you to use the resources that we've talked about for those additional questions. Now, one of the questions that we've received is we have some people asking about Maximus specifically. Are you able to address some of those questions?
I'll do my best.
Okay. The first one is there any state oversight monitoring Maximus?
Oh, yes.
Okay.
We have a full team that is working with them, and every time we find any issues or any concerns, we add extra training, extra scripting, extra information to that. I know Maximus, those who have contacted Maxis early on might have had some poor experiences. We've really, really honed in and focused on getting that strengthened. So please reach out to our Pathways team if you still continue to have issues. We would like to be on top of that and clarify, but yes, they are required to send in regular reporting. We do secret shopping for Maximus, as well as we have a team that's managing that.
Thank you. Let's clarify the role of Maximus for people who are watching that don't know what Maximus is.
Yeah, Maximus is our contracted enrollment broker for the Pathways program. So members who have received their letter to enroll in the Pathways program would contact the Maximus helpline, and they would help triage and enroll them or give them the information to pick one of the 3 MCEs. So it's a subcontract from the state to assist with us to make sure we had the quantity of call member or our members in the call center to be able to handle all of those calls.
Thank you. Okay, couple more, and then I think we'll wrap it up here. Can a caregiver or can a member of Pathways also be a caregiver? I think what this person may be talking about is some of the paid caregiver programs that would be provided by Pathways.
Yeah, I need more specifics on that situation. I mean, I'm not saying no, you can't, because I do believe that there are members who are also caregivers, but I think that would be too vague to be able to help specifically. So we asked them to reach out if you want to ask the specifics. We have a provider relations here in OMPP they can reach out specifically to, or if they are a caregiver, if they're working for an agency, to reach out to the agency that they work for to get the clarification they need.
Absolutely. Okay. And we have some questions about the differences in the MCEs. So we do know that they can vary. There is a standard that they each have to provide, correct? And then
Correct. There is a comparison on the website. So they have a plan comparison that's a nice one-sheeter that would give them the cleanest answers to that question. So we recommend go to, yeah, so definitely reroute to the Indiana Pathways website, and you'll look in the corner, there's a plan comparison.
Okay, perfect. Well, I think we've really covered it. We really appreciate your time. We appreciate everyone that has tuned in. And like Kim said, there are the resources with the websites. And if you're not online, you can definitely call and talk to the Pathways Help Center as well. So I'm going to put those numbers in our chat as well, so that you guys have that access in the comment section. And then just remember that you can also rewatch this video. And Kim, I just want to, Kim and the Pathways team, all of those that are sitting there in that boardroom, we really appreciate your time. Susan, do you have anything to add?
Yes, I did want to address this one question that came in the chat about basic eligibility requirements. And Kim, can you just stress to folks that the eligibility requirements for the aged and disabled waiver are not changing, whether it's by way of a Miller Trust or, income and income guidelines along those lines?
Yeah, so nothing is changing for eligibility. You still, that's why I said if you are not currently Medicaid and want to go in, you can still go through the AAA to get your qualifications through the waiver to be eligible, but nothing is changing. The only thing that's changing is our oversight and the shifting to include the MCE coordination to help provide better coordination between the waiver and the state plan services.
Thank you.
Well, I appreciate being asked to be included. Our Pathways team is always here to support all of our members and hopefully clarify any information that's out there. So please feel free to reach out, go to that website. There's availability to email us if you have any questions. And thank you very much for including us today.
Thank you for your time. Okay, guys, so we'll kind of wrap up. This does conclude our Medicare Monday, a Pathways for Aging overview Facebook Live presentation. So another huge thank you to the Pathways for Aging team for coming on and joining us. Another big thank you for Susan being on this morning as well. And thank you to all of you for watching. And we hope that we catch you. This is our last presentation for June this month. So we'll catch you in July, and we'll be posting those events within the next couple weeks. So check our Facebook page to see what we've got coming up in July. I know one of the big highlights is we will be joined by Social Security Administration. So that's always a popular one, and we're excited to have our guest on that. So without further ado, we're going to close this out and wish everybody a wonderful week. Thanks for watching.
Thanks.
Thank you.